Isha, would you like to tie this episode together with one last banger idea you just give out to everyone for free?
Yeah, sure. I can talk about, so I've, in my first nonprofit, it was incorporated. It's called Sigma Mental Health. So for Sigma Mental Health, it was related to mental health during the pandemic. It was an anonymous blog for youth in my community specifically. So in the GTA, or even just in Canada or in Ontario in general, to be able to put in anonymous questions about what they're going through. So whether it's a family dispute or if they feel like they want to change programs, but they don't know how to tell their family, or they're just feeling really anxious about the whole pandemic situation. They would put in that question, and then other youth from the community who had already experienced whatever they were experiencing and got past and persevered would be able to respond in a blog post and say, this is how I handled it. So not only are they responding to that individual, but a community of other people that may have been afraid to ask that question. The whole point was to create a community for them, which was big during the pandemic because you're in such a tight-knit space in your home, and there's a lot of clashes, there's a lot of anxiety, a lot of changes happening that you don't really know how to navigate. And the best thing you could do is probably like turn to Reddit. And back then, GPT wasn't a big thing either. So it was fairly independent and you had to figure it out, which is not easy for a lot of people. So that's what the purpose was. But an idea to spin off from that is something called My Mental Health. And I've seen a huge shift towards the importance of mental health nowadays as well. But it would be like an AI, and you would train it to be able to talk to an individual one-on-one. So let's say it wouldn't be like GPT, it would just be its own thing that has safe, secure kind of features in place, especially for those who may be experiencing issues with self-care or self-harm, so where they need additional supports or trigger buttons where they need to say, okay, I need 911 support, or I need to contact a healthcare professional, that kind of thing. But they would be able to talk to this AI and be like, I'm experiencing this. Do you have any suggestions? I have needed to do this. I just need someone to talk to, like that kind of thing. It's not a person, which is very expensive because psychologists are like through the roof in terms of money, but it's a
How
way to,
much per hour? I
Into
feel like for
corporate.
in person, it's got to be at least 150.
yeah. So there's a difference between psychiatrists and psychologists, but psychologists are the ones that are mostly doing the psychotherapy, talking to you, listening to you, giving you ideas, meditation, that kind of thing. Whereas psychiatrists are the people that are more referring. So they are a medical doctor and they'd be referring the medications and anything like that that would kind of subdue any more extreme illnesses, or if you have any disorders or anything from the DSM that's really like painful or anything like that that bothers you, they would be giving you the medication. So there's a big price difference as well for psychiatrists versus psychologists because one is a very heavily educated medical professional and the other one is less trained. Psychiatrists charge per hour. Yeah, so psychiatrists, which is the one, no, this is even for therapists, 250 to 500 per hour in Ontario, which is not okay for a lot of people to pay out of pocket that long because a lot of it isn't covered by insurance. It's also not covered usually by OHIP. So that out of pocket is pricey for your mental health. And that's something that should be covered under OHIP, but is still going through the motions of figuring out how to cover it. But yeah, so that's psychiatrists. And then psychologists, that's psychologists. So psychiatrists are, it's hard to find it. I can probably, an hour long initial evaluation is $550. Follow-up is $275. And this is a little bit much. And the allotment for follow-ups, which is the $275, is about 15-20 minutes. So this could vary, right, from place to place, from how experienced the psychiatrist or psychologist is and beyond. But it's pricey. It's very pricey.
If the
Yeah,
corporate people
sounds like
who
it.
are listening to this and they think that they're covered with a group plan, I've been covered with a group plan like that, and I've seen my allocation for those categories were only $500.
You go once and you're like, okay, you're good now. That's it.
Yeah,
Chill
yeah,
out.
just
Get a
like going for a consultation.
consultation.
That's it, done.
You'll know what's wrong with you, but you can't do anything about it.
Exactly.
So it's hard for mental health right now.
So that's the financial opportunity, I guess, per patient that you could get
Mhm.
using something like this. I mean, provide them something that comes close to it for a lower cost, and you're going up against something that it would otherwise cost $500. That's definitely sounds like a good sign. I actually have a really quick random question though. Is this at all similar to that friend.com thing?
I've seen that. It could be similar in a way, but it would be more geared towards professional support rather than just social communication. I said it in like, oh, we need to talk to someone, but I don't mean as like me talking to Josh or Runda. It's just an actual professional trained AI. So the inputs that you put into the AI, it wouldn't just be free range, just talking. It would be trained by psychiatrists and psychologists and anyone else like that. And you can be like, I would like to speak to psychologist AI Amanda, and then you could do psychiatrist AI Josh. So you could pick and choose. And then having that support of, I don't know if I'm okay right now and I need full actual support, or I need to contact a healthcare provider, or I need 911 support because I feel like I might do something, or if I don't feel comfortable right now, then there's those trigger buttons that you can press. And the AI keeps track of the way that they're speaking, talking, and what they can do further to support this individual.
I like that. I think there's such a market need for that, especially for the type of person that maybe they're kind of open to the idea of going to therapy or just seeking some type of help for any type of need for something that's mental health related. And they're maybe considering like, oh yeah, like I would like to look into this. And then when those costs start coming up, that might be turning those people away who, they might not even be a desperately in need for help individual, but still like they could have used help, but they probably just didn't take it because they realized that they might have just not been able to afford it. So I think that having something like this, even if it's not perfect, would just be such a good thing for the world to have.
Yeah. And the big thing with startups and all these ideas is they're not supposed to be perfect. You're supposed to just push it out and get that feedback and constantly keep moving for the community needs at the time. So whatever it is, guys, just do it. Nike. Yeah.
Oh,
You can quote that. You can just put that on a reel.
let's
use that.
I think that was a great idea to tie it together there with the My Mental Health. I think that low-key might have been the best idea that we had today, even though we didn't really spend much time on it. But I just wanted to say that one is something that I think there could be one person in this space doing that, but this could be literally be its own category of content that I would be shocked if you started putting out videos like that. If they didn't eventually start going viral and, building traction. I think that's a category basically waiting to happen right there. So if anyone listening to the podcast is looking for one that is like, oh, like, yeah, I have a free couple of weeks. Let me run with one of these things. Do that one. And then the audience that you build from it, you might be able to just throw another product on top of that. That's something else that we mentioned in this episode.
So interesting.
But yeah,
I go into these like startup pitches, even like sometimes in the clinical psychology sector, and so many of these clinical psychologists, they're just like working on modules that might be like proprietary, patentable as like a series of content to go through with a series of these programs. There's no real like idea that I've seen out there that's being pitched that are just like a clinical psychologist supported back AI chatbot. Because like to a level, I'm part of like the weird people demographic where like I kind of trust platforms more than like a person instead, which is probably a significant number of the market. Because like with like the whole instead of like filling out random forms to fill your personal information to hand over to a landlord, going on a dashboard like Neighborly was like so much more easier for these people, or like for people feel
most of my friends will call Ubers even when a taxi is cheaper.